Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Okay, I'm Dr. Janak Nathan. I'm a neurologist and an epileptologist. I've been trained way back in the 1970s.
Yeah.
And I went to the Johns Hopkins where I worked with Dr. John Freeman. I'm also the pioneer of the use of the ketogenic diet for epilepsy, uncontrolled epilepsy in Asia. And
Okay.
I'm very happy to say that I have trained most of Asia, Far East, Middle East, Africa, Egypt, etc. And in fact, on the 1st of Feb, we are having a large international pediatric summit in Dubai, where we are going to do a workshop on the ketogenic diet and epilepsy.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So a seizure has been described a long time ago. Actually, it's ancient. So so Hippocrates, what did he say? It's not a visitation, it is not a prophecy, it is not some someone has played some black magic or put a spell on you. It's like any other disease. It has a reason, and it occurs from it arises from the brain. And then later on, they even came up to saying that, okay, this is excess activity in the brain, which came maybe more than 300, 400 years ago. So we now know that any excess electrical activity in the brain can cause a seizure. Anyone can have a seizure. I can have a seizure, you can have a seizure, any one of us here can have a seizure. If we stay awake for long enough, we can get a seizure. If we have certain recreational drugs, you can get a seizure. If you have too much alcohol, you can get a seizure. If your blood glucose is low, you can get a seizure. If your certain electrolytes in your blood are low, you can get a seizure.
Okay.
But that is not epilepsy. So epilepsy is when you get recurrent seizures, which do not have a specific a precipitating factor, like sleep or a low glucose level or low sodium or something like that. And then you get these repetitive attacks, and then that is called epilepsy. So that's the difference between the two.
What are the different types of seizures? And do they affect people differently?
Of course. So let's go into what are the types of seizures, because that gives you an idea of what you're looking after next. So the first thing is, what are the types of seizures? And luckily now we know that there are just two types. Focal, which start in a particular area of the brain and spread. They may spread, they may not spread. They may go into unawareness or unresponsiveness. And the second is where they are supposedly generalized, meaning that they affect both sides of the brain simultaneously.
Yeah.
So when it is focal, it can start from any part of the brain. And I wish, can you just give me a second, and I will show you the brain, and I'll show the different parts of the brain.
Definitely. Sure.
That's your brain.
Yeah.
I think here you can see it better.
Yeah, better. We can see it.
So there are different parts of the brain. There's a part which will control your movements, part which controls your sensations, part which controls at the back over here, which controls your vision. This controls your thought process and memory. So any area of the brain can have excess electrical activity.
Okay.
And that excess electrical activity, depending upon which area of the brain it's coming from, can give symptoms like twitching of the face, twitching of the hand.
Yeah.
If it comes from the hand area, which is in the motor area of the brain, it will start with the hand. It will start with the face, if it's from the face area. Or you can get a sensation if it's starting from the sensory area. You feel numb on one side of the body or the
Okay.
side of the face, and then it may spread. Or you
Yeah.
don't see on one side. In fact, I just had a patient now,
Mm-hmm.
5 minutes ago, who told me that no, I'm getting only one fit in a year. And then I asked him, but do you get anything else, any short spells? And he said, yeah. All of a sudden, on one side of, I can't see anything. It
Oh.
could either begin on the left side, and then the whole left side I can't see. Sometimes it's on the right side, the whole right side I can't see. So that is a focal visual seizure. It begins in the visual area. It can begin
Okay.
from any area. If it begins from the auditory area, you'll see a sound. If it is from the thought area, you get abnormal thoughts. Some
Yeah.
people can get just abnormal fear if it's from that area.
Mm-hmm.
From the autonomic area, you can just get uh, funny sensations in your stomach. You can have feeling of very hot. The important thing is what? That it should be the same way every time. It's continuously, every seizure will be in the same way. It will present in the same way. Then you think that, okay, this may be a seizure. And then you investigate. Now, why do we need to know this?
Yeah.
Because we know that there are certain seizures which are very easy to bring under control, and certain seizure types which are really epilepsies. There are certain epilepsies easily controlled, epilepsies which are not easily controlled. Now, unfortunately, the ones which occur in the youngest age group are known as the epileptic encephalopathies, and they are very, very difficult to control with medication.
Okay.
And they are called epileptic encephalopathy because these epileptic seizures or epilepsy seizures affect the brain adversely and cause destruction of the brain, it causes regression of the brain. Therefore,
Yeah.
they call encephalopathy, meaning a pathological involvement of the encephalon of the brain. So, epileptic encephalopathies, they occur at a young age, anywhere between the first 2 days of life to the first 2-3 years of life, and they cause not just seizures, but they cause regression in the physical milestones. They can
Yeah.
cause regression in your intellect, memory, and all of that. So they are really bad because if you don't stop the seizures and control the seizures early enough, you
Yeah.
will end up with a child who is mentally and physically retarded. And that's the worst thing to do. Imagine a parent whose child is physically, mentally retarded for the rest of their life. You can imagine
Yeah.
how it will affect the whole family. So that's where we really come in, that we must be proactive in knowing which are the seizures which are not so bad, like the febrile seizures. You get the seizures with fever only. It only comes
Yeah.
with the fever. And we know that that's not going to cause much of a problem because after the age of 5 or 6, it will never recur. We know that there are seizures which come at the age of 18, 15, 18, and they just come with jerks. You saw that jerk? I just do that.
Yeah.
I
Yeah.
just jerk. And often enough, these jerks occur when you wake up in the morning, often enough when the person sleeps very late and wakes up early, gets very little sleep, maybe just 3 hours, 4 hours of sleep. And we know that that's not so difficult to control. Almost 90% of them will be controlled on medication. So to understand that is important because then you know how aggressive and proactive you have to be.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Well, I would say that there's usually not a known cause. Most often we just cannot find the cause.
Okay.
So, what are the known causes of epilepsy? Let's begin with the birth. A person who has an abnormal birth history, either it is premature, or the child had a difficult, and then the mother had a difficult labor, or the child did not cry at birth, as we say, meaning that the child did not breathe properly at birth, or there is a cord around the neck. The umbilical cord is around the little infant's neck, so that gets pulled, and obviously there's not going to be enough circulation because that cord contains the blood vessels going into the brain. That can happen. You can have various things that happen at birth. You can have things which happen before birth. The mother has a very high blood pressure. The mother has been having alcohol during the pregnancy. Mother has been using recreational drugs during the sorry during the pregnancy, and that will affect the fetus inside. Maybe the mother has taken certain medications which you are
Yeah.
not supposed to take. That can cause a problem with the fetus, with the child who's born, and then they can have seizures or epilepsy. Following that, in the first few days of life is very important. This is something that we see, unfortunately. The infant is born.
Yeah.
The infant does not get the mother's milk immediately. They are kept in some other room.
Yeah.
And the nursing staff may not realize the child does not feed well for the first 2-3 days, and then the blood glucose drops. If the blood glucose drops, the brain suffers immediately within a very short time, and that's what it suffers at that time may not even be realized at that time, because at that time they then give glucose, they give something, and it comes up. But later on in life, maybe after a month, 2 months, 6 months, you start getting seizures, and the mental and the physical delay in the development. So that's a big problem. The other
Yeah.
which we face at this young age is infections. If you have a birth which has not been done in very good sterile conditions, and in India, the labor rooms may not be well kept. There could be a place where, in a rural area, you really don't have very well managed labor rooms.
Yeah.
The infant gets an infection. That infection can get into the brain and cause damage and seizures. The third is the bilirubin. Sometimes you have this children who get jaundice at infancy, and
Yeah.
that, if it is very high, above a certain limit, we say 8 or something like that, if the bilirubin is very high, it causes damage to the brain, and that can cause mental, physical delay and seizures. So that's the time when you are very, very careful about any day.
Okay.
Then comes the infections, which can come at any age. You know that. It can give rise to seizures. The trauma. Obviously, trauma can give rise to seizures, which can come immediately or it can come after a few months.
Yeah.
Then you have the people at the older age, because now we are seeing people living till an older age,
Yeah.
and the incidence of seizures after, say, maybe 60, 70 go on increasing.
Okay.
It's high in the initial, it goes down in the teenage adult, and then in the late adult, that is in the geriatric, it again goes up. And those are because of two things. One is that the circulation is getting affected, either because the person has diabetes, has got hypertension, is not looking after their metabolic health. I do a lot of work in metabolic health because I think that's the place to make sure that we don't get all these illnesses.
Yeah.
And the third is degeneration. Now, degeneration again is very much linked to your metabolic health. Metabolic health literally affects every part of the body, including atherosclerosis, heart, the renal failure, the liver failure, the brain, the paralytic attack, everything, all the degenerations, Alzheimer's, all come from poor metabolic health. So more and more we are finding that these people who are young, who are middle-aged, are not looking after themselves.
Yeah.
They don't go to sleep on time. They sleep very little. They sleep at odd hours. They eat junk food. They eat too often. They eat the wrong food. They don't exercise, and then they go into metabolic poor health, and then they get all these problems, and then that will give seizures at a later age group. So I think I've gone through most of it, but in spite of that, we'll find many patients whom we're not able to find out the cause of epilepsy.
Yeah.
Having said that, the tests that we do for epilepsy, namely the EEG and the MRI or CT scan, is not always positive. And EEG may be positive in 40%, MRI may be in 15-20%, and in a large number you won't find any abnormality, and yet that person has seizures and has to be treated as such.
That's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Any repetitive movement, any repetitive behavior has to be looked at with suspicion in a child, infant. Why? Because the child or infant can't tell you something is wrong. So therefore you don't know. You just see the same thing happening again and again. And we see, as I told you, the myoclonic jerks, and the hands go up, which we call as an infantile spasm.
Yeah.
So unfortunately, many of the patients who come to me, the parents said, "Oh, it must have begun earlier because I used to see these abnormal spasms, and I didn't think. I just thought that the child is scared or is because of the sound is getting this jerk." And even sometimes the doctors miss it. But if you get the same thing repetitively, you must immediately think that, okay, could this be a seizure? And go to a good doctor and get it checked out. Could this be a seizure? So that's one of the things. Repetitive, same behavioral or abnormal movements.
Yeah.
The second is when the child is able to understand. You can have them in school where they just zone out. They say, I just zoned out for 5 seconds and then I was back again. And it happens repetitively. So what we call as absence in our language, but it is really absence. For a few seconds, you're absent. And that can happen when you're a child, 6 year, 8 year, and the teacher just says, oh, this fellow or this boy, he's always daydreaming. Every time I'm speaking, and then suddenly he just zones out, he's not with me, and then he comes back. And that could be a seizure. There are then the myoclonic jerks, which I already showed you. And of course, the ones that all of you have seen are the ones where you fall down and you shake, and so that anyone will know.
Yeah.
These are the ones which are not so easily picked up. The ones where you have just like this. A driver who came to me, right? I just told you about him, who thought that he's only having one seizure a year, and actually he used to have these episodes where one side he can't see, and obviously when he can't see, he had to be removed from his job. He lost his job because whoever was treating him didn't realize that these are also seizures, and it's not just 1 fit a month; it is now many per month. No, sorry, not 1 fit a year, but many per month. So we have to control those. So the focal ones are the ones which are often missed. But they are all the same, that every time he gets the same symptom. I can't see on one side, and it lasts for 5-10 seconds and it's gone.
Now let's talk about something that many people with epilepsy face, stigma. Can you tell us why epilepsy is often misunderstood?
I wish they had read Hippocrates 2,400 years ago. What did he say? This disease is not sacred, it is like any other. It is not a visitation, it is not a prophecy. It is not, what he meant was, it is not a black magic. 2,400 years ago, father of medicine Hippocrates said this. And yet in the Bible, many years later, obviously 400 years later, it's mentioned that the boy was possessed by demons, and he often fell into fire and often fell into water. You're quoting this from the Bible.
Okay.
And they go to Jesus and say, "Oh Lord, I went to all these doctors and they couldn't cure him." So Jesus says, "Okay, come after a week." When they come after a week, they find that their son is perfect. And they say, "Oh Lord, this is a miracle." And he says, "No, this went out by fasting." So fasting as a method was known to Hippocrates as a method to control fits. And it's mentioned in the Bible. And I think in the Ayurveda also there are certain instances, and there are certain people who use this. In order to control their seizures, they would go on these fasts for maybe a few days, and then the seizures would just disappear and maybe come back after months. So we know that uh, this was then thought of as visitations, and because people behave abnormally at that time, they just stare into space. You
Yeah.
have something called automatisms, where they make movements like that, or movements of that type, and then they say, "Oh, this person is he's just crazy." No, he's
Yeah.
not crazy. He's getting a seizure, which is known as automatic movements. He doesn't know what he's doing.
Oh.
So therefore, that whole concept came up that this is black magic. This is something that he's done wrong. You got to get rid of it by uh, voodoo, by whatever, by the witch doctors, and they started beating up these people, and they did all sorts of horrible things, not realizing that these are
Yeah.
seizures and these are epilepsy. Girls are not getting married because they have epilepsy.
Okay.
Boys are getting married in spite of having epilepsy.
Yeah.
Neither of them are right.
Okay.
It's the instances of familial epilepsy or inherited epilepsy are very, very few. The incidence will not be more than 5% or so.
Yeah.
Most of them are not inherited, and it is not passed on from the father to the son or the mother to the son, or
Yeah.
daughter to the child, daughter or son. So therefore, this whole thing that, oh, but this girl has got epilepsy, so therefore we should not marry our son into that family.
Yeah.
No, I think that's very wrong. I have hundreds of my patients who have got married because I call the to be groom and family and I speak to them. I say, this is all rubbish. Go ahead, I'll show them photographs of my other patients with
Yeah.
babies. But okay, they can have a baby, they can have motherhood, they can have two babies, and nothing's going to happen. They're not going to pass it on to the baby. So don't worry about it.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
I think the most common is missing your dose. If you forget your dose, that's the most common. The second most common, which we don't realize, is not sleeping on time in the dark. It's
Yeah.
not enough to sleep between 2 and 8, 10 and say, I got 8 hours sleep, 2 in the morning to 10 a.m., and sleeping at 10 a.m. and waking up at 6 a.m. It's quantitatively equal, but qualitatively totally different.
Yeah.
Your brain and body repairs only when you sleep in the dark, not after 5 or 6 in the morning.
Yeah.
And you need that sleep because the repair of the brain starts when you go into deep sleep, which is about 1.5 hours after you actually go to sleep. So you need 8 hours sleep. Every adult, this is for the adults. The kids need 9 to 10 hours, and even the younger ones 10 to 12 hours. And yet, when I go for a movie at night, which is a late night movie,
Yeah.
I find that there are little kids, 6-year-old, who are awake till midnight and 1 o'clock in the morning seeing a movie. It's very, very wrong of the parent to take them out, take them in the evening for movies. So this is very bad for health. It's very, very, very dangerous for a person with epilepsy because they can get a breakthrough seizure. When they're well controlled on a certain medication, in spite of the medication going on, in spite of being regular with the dose, if you miss your night sleep, you can get a seizure, and then you begin from zero. You begin all over again.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Okay, now if the person is going to fall, so he's going to fall down and he may hurt himself that time. But once you see a person with a seizure, what are the few things? Push away all furniture and hard items which may hurt him. Second, do not hold him down. You'll see many times that they're trying to hold them down, trying to stop the movement of the limbs. That causes more injury to the soft tissue by holding down the person.
Yeah.
Second, turn the patient's head to one side so that whatever your saliva collects in the mouth, it comes out and doesn't go in.
Yeah.
Do not put anything in the mouth,
Mm-hmm.
because we are, everyone tries to put in a spoon, tries to put in something into the mouth,
Yeah.
saying that, oh, I don't want him to bite the tongue. Tongue
Yeah.
bites occur in the first 5, 10, 15 seconds before you can do anything. If a
Yeah.
tongue bite is going to occur, it occurs very, very early in the thing. So
Okay.
therefore, don't do anything. Don't put your finger in also. I've got people who have fingers have got bitten off. Because
Yeah.
they are going to really very uh, bite very hard down on that.
Mm-hmm.
So don't do anything. Just turn the head, turn the
Yeah.
turn the person to one side, hold him lightly. If possible, if you have something, put a pillow or even a cushion or even just a cloth that you can find, put it under his head so he
Yeah.
doesn't bang his head. Wait till the seizure stops.
Mm-hmm.
If the seizure doesn't stop within 3 to 5 minutes, call for an ambulance.
Yeah.
Uh, Once the patient has recovered, and 90% of seizures do not last for more than 3 to 5 minutes, they do not need hospitalization immediately. So 9 out of 10 don't need a hospitalization immediately. If it lasts for more than that, then you need hospitalization. And once the patient is conscious, do
Yeah.
not put anything in the mouth till he's fully conscious, because even at that time he could choke
Yeah.
on his whatever you pour water or whatever. No, you don't need water, obviously. I mean, it's not like that every time you get a seizure you need water immediately.
Mm-hmm.
So he's not dehydrated and he needs
Yeah.
water urgently. No, he doesn't need anything. So let him come out on his own, and then you find out where he is from, etc., etc. So the two main things are: don't hold the patient very tightly, remove all objects on which he can hurt himself, uh, turn him to one side, that is the third. Don't put anything in the mouth, that is the fourth. And the fifth is wait until he regains consciousness before giving him water.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
In
Yeah.
spite of all the advancements
Mm-hmm.
in medication,
Yeah.
25 to 30% of all patients with epilepsy will be uncontrolled on medication.
Mm-hmm.
I am on the International Epilepsy Task Force
Mm-hmm.
for dietary therapies.
Yeah.
And we know that anyone who is uncontrolled and you have tried 3 to 4 medications, the chances of control are not more than 1 to 1.5%.
Yeah.
As I told you, in 1996, I started the first ketogenic diet center in Asia, and we have a record of about over 1,000 patients. Bad epilepsy can be cured. I have patients from all walks of life, from
Yeah.
judges to actors to entertainers to doctors to engineers to manual laborers to athletes who have epilepsy and are perfectly all right.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.